The antithrombotic treatment in TAVI patients who are not on oral anticoagulation is similar to those treated with a PCI, which is dual antiplatelet therapy early after TAVI. However, TAVI patients are considered to be more at risk for bleeding due to the advanced age, more comorbidities, and the use of large bore catheters. Therefore, in the cohort A of the popular TAVI trial, we hypothesized that the omission of clopidogrel after TAVI reduced bleeding while not increased thromboembolic events. And therefore, we randomized in total 690 patients to either aspirin alone or aspirin plus 3 months of clopidogrel. 331 were randomized to aspirin alone, and 334 were randomized to aspirin plus clopidogrel. And the results of the primary outcome, all bleeding, were significantly reduced with an aspirin alone strategy, with an absolute reduction of almost 11%. The results of the co-primary outcome, non-procedural bleeding, were also significantly reduced with an aspirin alone strategy, with an absolute reduction of almost 10%. And for the secondary outcomes, we used 2 composite outcomes. The first composite outcome was the composite of cardiovascular mortality, non-procedural bleeding, stroke, or myocardial infarction, which was superior for aspirin alone and significantly reduced with an reduction of 8.2%. And the second composite was the composite of cardiovascular mortality, ischemic stroke, or myocardial infarction, which was non-inferior. Aspirin alone was non-inferior compared to aspirin plus clopidogrel for 3 months, with an absolute difference of 1.2%. And the conclusion is that of the popular TAVI trial cohort A is that an aspirin alone strategy without clopidogrel significantly reduced the rate of bleeding events and does not increase the rate of thromboembolic events.